Hello, everyone. Thank you for tuning in. Today, the topic of the podcast will be about myofunctional therapy. And I'm so happy to have with me today Jackilyn from Solutions. Jackilyn, we're so happy to have you. Actually, myofunctional therapy is a topic we wanted to talk about long time ago, because in our clinic, in our work in speech therapy, we get a lot of referrals from patients from orthodontists that come to us whether to correct the tongue posture, the mouth breathing, to correct the atypical swallow, and then most of the time we feel like we need more tools to correct or to avoid the following. So therefore, we're so happy to have you to talk about and we have more practical tools in myofunctional therapy. So first, if you'd like to introduce a bit yourself before we start.
Hi, Teresa. Thank you so much for having me. I'm a dental hygienist. I'm a dental hygienist, myofunctional therapist, and I have my own practice, and we've been open for about 2 years now. And I really got into this because I saw the issues and impact of my children and of myself. And I was like, I have to get this information out there. Like, I have to let other parents know. And so that's what brought me here today, and just bringing awareness.
Yes, that's great. We're so happy to have you. So first, we'd like to know what is myofunctional therapy, how it works. And also we want to know, like, is it evidence-based? Like, has it showed efficiency in literature?
So myofunctional therapy, it's almost like physical therapy for your tongue and your face for the muscles, essentially, to help them working properly and get them functioning the way that they need to function. And so there is a lot of literature out there that supports that myofunctional therapy is very effective, especially in sleep. And there's a lot of benefits that come with myofunctional therapy, and it's absolutely necessary and critical that every person that goes through speech therapy is looked at for myofunctional disorders, because they're very highly linked together. And so what myofunctional therapy looks like are exercises. And so with every patient, we give like a little goodie bag of different things that are used to help the patient achieve the exercises we're asking them to do. And so one of the exercises that I really, really like, especially for strengthening the lips for mouth breathers, is we grab like a little button that's attached to a string, and we place this button right in front of our teeth, and we wrap our lips around the button, and we pull the string, and we continue pulling it for a good 5 seconds, and we pop it out. And so what that can look like is this. And so I really like that exercise, and kids love that exercise because they get that popping noise, and it's super fun to do. And sometimes I like to turn it into a mommy and me exercise, where you have the child on one side and mommy on the other side, and you're making this game of like a tug of war. So
yeah, that's great. So that is mainly to have the mouth closed while breathing, and to promote the nasal breathing.
Yes. Myofunctional therapy is used for kids who are mouth breathers or who have an atypical swallowing pattern. Or who even show signs and symptoms of sleep disordered breathing, because that can mean that the tongue isn't working properly or functioning properly. So the tongue isn't up on the roof of the mouth like it's supposed to. It's resting either in the middle or down.
In that case, when we have a tongue thrust, or when the tongue is not against the palate, what are tools or exercises you recommend for the patients to have that reduced, to improve their posture?
So one of the things I really like to do is I like to grab a tongue depressor, like a big popsicle stick, and I like to have them put their tongue onto it, bring the tongue and popsicle stick in, bite it, and close their lips. So
Mm.
And right there,
Wow.
automatically, the tongue goes up to the roof of the mouth exactly where it needs to be. So, and what I mean by that is that the tip of the tongue is on right behind the
Wow.
two front teeth, not
Yes.
touching the two front teeth, right? And the middle of the tongue is up, right? And the back of the tongue is up. And so when you do that exercise with the popsicle stick or tongue depressor, it automatically places the tongue exactly where it needs to be. And
Yes.
so I'll sometimes have my clients hold this position for about maybe 5 minutes 1 week, and then the next week 10 minutes. But the longer, the better, because then this can rewire and help the brain to think that
Yes.
this is where my tongue needs to be, morning, day, and night.
We just have a comment. Can you please demonstrate with popsicle stick again? So could you do it again? So
Yes, so you'll place the tongue onto the popsicle stick, and you'll place your tongue in the middle. So it's not too far like this. Okay, it's right in the middle. Okay, so you're gonna bite on the popsicle stick and then close your lips. And your tongue should remain on the popsicle stick during the exercise.
yes, so that you would have the tongue up. Thank you so much. Thank you so much. And then it's also important that those exercises should be repeated a lot of times daily, like because again we're rewiring like a habit, so it should be done every day. There should not be a motivation by the patient to reach that. And for the atypical swallow, here where it gets a little bit more complicated. So for the atypical swallow, how do you get to also have the tongue thrust, improve the tongue thrust in the atypical swallow, and while with the food also and all that? How do you deal with it?
So that's very, very challenging. So that's something we work on throughout the whole entire myofunctional therapy program. And so myofunctional therapy can last anywhere between 6 months to a year to complete.
Yeah.
And all of the exercises that we are doing through myofunctional therapy are going to help that atypical swallow.
Yes.
And so the atypical swallow is actually a very complicated movement. It's a very complicated just movement of the tongue, and so it takes a lot of strength and coordination and function for the tongue to move correctly, to be able to learn how to swallow correctly. And so we always start with the basics in myofunctional therapy, which is strengthening the tongue, getting it to move the way it really needs to move, and really having that lip strength.
Yeah.
Because we really need to have that lip strength and learn how to identify the difference from the tongue working separately from the lips and the mouth. Because a lot of people don't know that when you swallow, you're actually not supposed to be using your lips or any other
Exactly.
muscle besides the tongue. And so the tongue should be doing the swallowing only. And it's super, super important. And so we have to train these other muscles first before we go into the swallowing, so they can learn how to work separately from each other.
Very interesting.